How many times are you peeing at night now that you've hit that certain point in your age where you're like, oh, I'm there. I'm there. It's happened. I must be old. Hi, I'm your local OBGYN. I love women and let's talk about it. This is not all in your head. This is something that can be fixable. So let's learn a little bit about nocturia. So nocturia basically means that you pee in the evening. And there's a few multifactorial reasons that this happens, but we can come down to a common thing that will help all of the above. Number one, just the same way that we lose some of the elasticity of our vagina and it doesn't stretch as much, same thing happens to our bladder as our estrogen levels go down. What has to happen with your bladder is it starts to fill and stretch kind of like a water balloon. All right. Now, when you have good stretch to that water balloon, you can fill up with more, meaning you can go longer between peeing. But when you have less stretch of that water balloon, it's going to kind of hit that maximum sensation in your head much earlier. So estrogen decrease actually makes your ability to fill the bladder with less volume. So you feel like you need to get up to go to the bathroom more. Number two, the decrease in estrogen messes up your circadian rhythm of something called ADH. ADH comes from the brain and tells your body how much urine to actually make. So when that circadian rhythm gets screwed up, you're actually making more pee at night than you used to, even though maybe you're even water restricting right before bed. Again, from estrogen deficiency. Number three, okay, all the night sweats and hot flashes that you experience that are waking you up, it is waking you, but at the same time, your brain is kind of confused with this dysregulation and saying, I think it's because I have to go pee too. So three factors: one, loss of stretch; two, you're actually making more pee; and three, the other symptoms of perimenopause and menopause are waking you up. So adding estrogen back in can improve a lot of that, or there are medications that will stop the spasming of the bladder as much so that you get that signal less frequently because the muscle is not squeezing down.